Got it, Ben. Today's coronavirus numbers. Let's track those. The state reporting 891 new confirmed cases over the past 24 hours. That's a notable drop from yesterday, as you recall, that was over 1,000. However, Michigan has also lost 19 more people to the virus. Governor Whitmer is out today talking more about COVID-19 and its impact on the state. And in particular, she's talking about the millions of dollars spent on specialized hospital locations. Our Rod Maloney live tonight with more on this. Rod, you've talked to the governor, interviewed the governor many times during the pandemic. And I think today you were feeling a difference in tone.
Yeah, there's a decided difference in the tone, Devin. It's less stark. She's not speaking in such dark terms about the virus. She says, look, COVID's with us. It's going to be with us for a while. But she says we know a whole lot more about it. And she's quite upbeat about the vaccines and the therapeutic stuff that's coming our way.
We've all got to continue to take this seriously. Now, it's not going to last forever.
Still, last night, the governor felt the need to change her nursing home policy, moving away from the hub system, where she put COVID-positive patients just out of the hospital and homes with otherwise healthy residents. She now wants those patients put into a newly classified care and recovery center, nursing homes with higher quality ratings. At the same time, she's loosening some of the communal meals and activity strictures as long as they're socially distanced.
People can resume a little bit of normalcy. We know that our older people are uniquely vulnerable to this particular virus.
Many in the legislature wanted these patients in separate medical facilities like the suburban Showplace. The state spent millions on it. The governor extended the $1 million a month lease through the end of the year on the place, even though few patients have ever spent any time here.
We know that we're going to have some plan in the event we start to see cases climb again. The last thing we want is for that to happen. But we need to be prepared.
And as for whether Lions fans will ever get to watch football live,
we don't have the on-site instant testing available yet that would really be important to being successful in that space. So we're continuing to work toward that goal. It's all of our hope that we can meet that goal soon, but we are not there yet.
Now, as I said, she's very excited about the 9 different tests, the 9 different vaccines that are in testing right now. And also she said that she believes that the therapeutic treatments that are coming have a lot of promise as well. But she said, as things stand today, even though things look better, this is the really best answer, masking up. Back to you.
Same as it ever was, I guess, in a way. Rod, back to the suburban Showplace, and we saw this with the TCF centers as well. There were obviously a lot of problems that kept them from being perfect for the use that they were designed for in the beginning. What changes now with that as we move forward?
Well, as it stands right now, Devin, it looks like they're going to be reducing the size of the operation, number of beds perhaps, but they're taking it down from about 425,000 square feet to just under 400,000. And they were spending $1.1 million a month on that, and they're reducing that contract to just under $1 million a month. So it looks like they're making it a little bit smaller, but they say that they need to be ready, and so they're going to leave it as is at least through the end of the year.
Got it. Interesting stuff. All right, Rob.